Are you spending hours memorizing nursing content to only get in front of your next exam and realize you don't remember anything? You're not alone. Nursing exams are not intended to test your ability to memorize facts and figures. It's intended to see if you can apply clinical judgment to real-life nursing scenarios. You need to think like a nurse. I'm here to show you some cool ideas and ways to flip your process into learning about real-life scenarios instead of memorizing content. Memorization might get you through a pop quiz, but it won't prepare you for a 60-question exam filled with patient scenarios. Nursing exams are designed to mimic clinical practice. So, instead of asking, what's the normal sodium level, they're going to ask, your patient's sodium is 125, and they're confused. What is your priority? Do you see the difference? One is recall, the other is clinical judgment, and your success depends on practicing clinical judgment. The clinical judgment measurement model is your blueprint for both studying and test taking. Here's how to apply it to your notes. Let's start with recognizing cues. Recognizing cues means that you're going to highlight the signs and symptoms and the patient data that matters the most. For example, if you're looking at a patient that has respiratory distress and their heart rate is 145 and they're complaining of chest pain, what would the cues be? Next, let's talk about analyzing those cues. So we know that our patient has chest pain, respiratory distress, and their heart rate is very tachycardic. What do these findings mean together? You need to look at the whole picture, not just one finding or another, to help decide what's your next steps. Once you have evaluated and looked at those cues, you can decide which problem is the most urgent. We have a patient that's having respiratory distress, chest pain, and tachycardia. Well, as you know, we always talk about ABCs, airway, breathing, and circulation. All three of them are important, and in real life, we may be dealing with them at the same time, but when you're taking a test, they're going to want you to decide which one is first. In this case, we need to deal with the airway and breathing first. If the patient's not breathing, then it doesn't matter about all the other items that we need to look at. After we do the airway and breathing, we're going to go to circulation. We're going to look at this patient and see, okay, they have tachycardia and they're complaining of chest pain, and we will attend to those issues. Finally, we need to generate solutions. So what are the solutions you're going to do for this patient that has chest pain and respiratory distress and tachycardia? Well, for our respiratory issues, we may have to get an arterial blood gas. We're definitely going to put them on oxygen first and foremost and put them up in the bed higher so they can breathe more easily. Secondly, the patient's having tachycardia. We probably need to get an EKG, and we have to deal with that chest pain. Find out all the things that you would need regarding to pain and determine, is this chest pain a cardiac issue or not? You may not know that as a nurse, but some of the solutions you can consider would be getting a 12-lead EKG, calling cardiology in, getting some labs. Once you've matched those solutions to the problem, you can take action and evaluate. Like I said, what are we going to do first? And how is it going to happen? Who am I going to call on? What resources do I need? I'm going to tell you a little bit about the difference between active studying and passive studying. Many nursing students practice passive studying. What that means is that they're rereading their notes over and over and over again, and they're watching the videos over and over and over again, and they're highlighting their notes. They're trying to memorize all this information just so that they can know it for the exam or quiz. Unfortunately, with passive studying, you are not really learning the content, and you really are just going to have a data dump after you take your exam. Let me give you some examples of active studying. Here's one. Teach a concept to a classmate or even read it out loud to yourself. If you can explain the diabetic ketoacidosis in simple terms, you'll own it. Another thing you can do is build concept maps that connect the disease, the pathophysiology, the cues, the interventions. You should be practicing NCLEX-style practice questions daily, and don't just check the right answer. Deconstruct the question. Ask, what cues were in the STEM? Why was this option the priority? And why were the other options not the priority? Remember, when you do practice questions, if information is not there or if it's an expected normal, remember those things, because that's going to help you be able to filter through the items that are not relevant to the question. Another example is you can take your notes and turn them into mini case studies. For example, my patient has COPD with an O2 sat of 87%. Which cue matters most, and what do I do first? That's the kind of thinking that exams demand. Are you up for the challenge? On exam day, preparation meets execution. Do not cram the night before an exam. Your brain needs to rest and it needs to consolidate the information. Before you take your exam, make sure you've had something to eat and to drink and you have gone to the bathroom, especially if you're doing it remotely. Make sure you're taking some nice deep breaths before you take the exam. We don't want test anxiety to set in. Remember, read each question carefully and slowly. You have plenty of time to answer the questions. Determine which ones are the cues in the question stem. Once you get to the answers, if you have more than one answer that you believe could be correct, you need to go back and look at each of the answers and determine which one has the highest priority. Remember, this is not memorization. This is clinical judgment in action. Here's the bottom line. Nursing exams aren't trying to trip you up. They're trying to prepare you to think like a safe, effective nurse. So don't just study to pass, study to practice. Use clinical judgment as your guide, and you'll walk into that exam with confidence. I hope you'll continue to follow me for more information about how to study and prepare to think like a nurse.